Dr. Weiss, I know that you have really utilized the medical social workers as part of your team, and I was wondering if you could give us some examples of how you're working with them.
Okay, I'm glad to, and thank you for asking. I find having social work really valuable in my care of patients. They can extend me, and I'll tell you some examples of what happened just last week. I had a family bring their mom in who's recently just really decompensated in terms of dementia, and they had no idea where to turn. Like, how do I start with caregiving? How do we have her not drive? How do we do DPOA? What do we do about pulse? You know, what's the next steps? And I was able to call Jordan in and just say, can you really be an assistant to this family? Another patient has Parkinson's. She's living with Parkinson's, but we need to get a U-step walker. We need to get her involved with the Parkinson's support groups and Parkinson's yoga, and she had no idea what services were available. I have another poor child who has severe autism. She's chomping her arm, and the family can no longer care for her without resources, and I didn't know where to turn. I can spend time Googling it, I can look things up, I can try to get resources, but I'm not going to do that as well as somebody like Jordan who's a social worker. And plus, when I spend my time doing that, I'm not able to care for my next patient. So in those instances, I called Jordan in, and he was very helpful.
Thank you, Mary. That sounds like a really great resource for both you and certainly for our patients. Thank you.
Yeah, you're welcome.
Mary, I was wondering if you could give us some instances, perhaps where the medical social worker had helped you with some mental health issues with your patients.
Thanks for asking that. It's very common that patients come into primary care with symptoms of depression, and sometimes it's relatively mild, and I'll have Jordan come and meet with the patient in the room. It's what we call a warm handoff. He may be able to address their concerns right in that visit, or may be able to see them back for 1 to 3 visits. Commonly, he will then refer the patient on for ongoing care, and that can be regular depression, anxiety, or there are some cases where they're very severe, even suicidal, and Jordan can help in that moment, as well as referring them for additional resources.
Wow, that sounds like a great resource for our physicians and our patients.
I agree.